Welcome to the Egg Whisperer Show. I'm your host, Dr. Amy, and today we're exploring something that might surprise you. Your mouth could be telling you more about your fertility than you think. My guest is Dr. Katie Lee, a nationally recognized dentist, speaker, author, and she's the founder of Collective Health Society in Centennial, Colorado. She has a powerful personal story. After surviving a traumatic ATV accident as a teen that left her without many of her teeth, she became deeply invested in the life-changing power of dentistry and dental implants. Since then, she's owned and led over 80 dental practices, educated general dentists across the country, and now consults for health tech companies while seeing patients. She's also an author of Saved by the Mouth and has been named one of America's top 40 under 40 dentists and International Woman of the Year in Dentistry. Today, she's here to help us uncover the surprising ways your oral health can impact your reproductive health and why your dentist might know more about your fertility than you think. Let's dive in. Welcome, Katie.
Thank you so much for having me. I'm really excited for this opportunity.
What's the most surprising thing people don't know about the connection between oral health and fertility?
I think probably that there is a connection. For so long, people have kind of been told, avoid the dentist. If you're pregnant, don't go see the dentist. What they do could maybe harm you or, cause a miscarriage or something like that. But that's really not true. In fact, everything that we do is really for the benefit of the mom and the dad during their fertility journey. So I would say, yeah, most people just don't even know that there is a connection. And then the other thing is just how powerful the oral microbiome is, meaning that it is transmissible and contagious. So if you are healthy, but your partner is not healthy, they can definitely transmit that bacteria to you and cause a lot of harm. So I'd probably say those two things.
Okay, you just said something that just completely blew my mind, the dad part. So talk to us about the
Yeah.
dad part.
Yeah. So most infertility, unfortunately, is kind of blamed on the woman, right? A lot of people think that if someone's having fertility issues, that it's the woman, advanced stage, her ovaries aren't working, whatever it is. But as you know, infertility is really 50-50. 50% lies with the woman and 50% lies with the man. And we know that the oral microbiome directly affects the man's sperm count, their morphology, and their motility. But even further than that, yes, the oral microbiome is completely transmissible. So if he is unhealthy, not only will it affect his sperm and the quality, he can transmit that bacteria to his wife or partner and cause a lot of microbiome changes with her and affect her fertility as well.
So, guys, find a clinic and go get seen. How can gum disease, dental infections, or even cavities contribute to systemic inflammation? And how might that affect hormone balance and fertility?
Yeah, so there's really two ways that the mouth can affect fertility. There's specific bacteria that are part of the oral microbiome, which is made up of over 754 different types of bacteria. So there's specific bacteria themselves that will directly impact fertility, whether it's sperm, as I mentioned, or the ability to ovulate, the ability for the embryo to implant, or for even the ability for the mom to carry the baby to full term. But then we also see a lot of issues with just the amount of inflammation that's created from infections in the mouth, whether it be from root canal infections or tooth abscesses, from dental decay, or from periodontal disease. So we either have bacteria causing the issue, or we have chronic systemic inflammation causing the issue that could be coming from the mouth, basically in those two ways.
And you shared a little bit about the microbiome already. For listeners who don't know what it is and why it matters for reproductive health, can you enlighten us?
Yeah. Everyone is really familiar, I feel like, with the gut microbiome, right? And perhaps if they're fertility patients, they already know about the vaginal microbiome. But the oral microbiome is actually the second largest microbiome, second to the gut. And if you think about it, the gut is internal. So we have to take a step back and think about how did the gut bacteria even get there? Well, it's coming from the mouth, right? The mouth is the largest entryway into the body. And so we know that there's about a 40 to 45% overlap of the oral microbiome and the gut microbiome. So it's really important that we keep our mouth super healthy because that is going to directly affect the microbiome in our gut and really the rest of the body. And so the microbiome is just all the things that make up the mouth. We have bacteria, we have viruses, we have our fungi, we have all these things. And it should be in a level of homeostasis where everything is balanced and healthy. And our microbiome in our mouth should be able to fight off bad bugs that cause gum disease and cavities. But unfortunately, most of our microbiomes in our mouth are in what we call dysbiosis. And so they're unhealthy. And then that's when we see things like viruses, periodontal pathogens, and even fungi start to multiply and kind of take over. And that's when the damage occurs.
So that's now that you're saying that, I'm wondering, is there a test for the oral microbiome? Because there's vaginal swabs, there's stool tests. Is there like a swab that people do to check their oral microbiome?
Yes, exactly. So I'm so glad you brought that up because that's something I'm really passionate about. In dentistry forever since inception, we knew that microbes caused issues, but we never really had anything to test for that. Salivary tests have been available in the US since the early 2000s, but they're really only starting to become mainstream within the past, oh my gosh, I don't know, 7 years or so, 10 years max, maybe. And, it's really important that, as you know, in your field too, that we have to test so that we know what we're dealing with. Because, as a dentist, we kind of have these blanket treatments for cavities or these blanket treatments for gum disease. But what we know is that dental decay is one of the most prevalent diseases in the world, as well as periodontal disease. And in fact, the incidence of gum disease is on the rise by 34%. So clearly what we're doing as dentists is not working. And it's because in the past, we haven't been using specific microbe tests and targeting our therapies to treat specific pathogens. So now, yes, we have several saliva tests that we can do for patients. And then based on their bacterial profile, we can kill off the bad pathogens, replenish the mouth with the good pathogens that should be there, and then hopefully promote the patient's best oral health.
And then have you found that oral infections or microbiome imbalances could play a role potentially in some of the most common fertility issues that I see, like endometriosis or PCOS?
Oh, big time. So there was a study that came out, I want to say around 2023. It looked at 155 women and that had endometriosis. And they biopsied the uterine lining, and 64% of those patients with endometriosis had oral FN bacteria in their uterine lining, compared with 7% of healthy people.
Are you swearing at me,
So
Katie? Oral
no,
effing?
I am oral effing. I know. I was on this other podcast last year, and the host kept saying that effing bacteria, like that was her kind of tagline. But yes, it does sound like I'm swearing, but no, I'm not. But yeah, so very common in endometriosis. I had a patient actually in my clinic that came in. She was in her mid-20s, seemingly healthy. She came in for a cleaning, and we started doing her exam and cleaning, and my hygienist came and got me and said, "Doc, something is wrong with this patient. I've never seen so much blood, and her teeth look clean." Typically, we see a lot of blood when someone has a dirty mouth, but her mouth looked really clean. And so we did a couple different tests on her and found out she had a massive infection with FN. We treated her, and she came back 3 months later, and she had improved quite a bit, but still not to the level that I would expect for our targeted therapy. So I sent her to a functional medicine doctor, and it turned out she had systemic endometriosis and had no idea. And so, yes, FN definitely is linked to that. And then with PCOS, there's really a bi-directional relationship there because, patients with PCOS have a lot of, or oftentimes will have increased male hormone presence and then insulin resistance. And we know that those two things cause inflammation, but they also change the balance of the microbiome in the mouth and promote the prevalence of periodontal pathogens. And then on the flip side of that, periodontal disease or periodontal pathogens cause inflammation. It changes the gut microbiome, and then it can exacerbate PCOS. So yes, both are directly linked to oral bacteria. And so what I do is I partner with a lot of women's health doctors or fertility clinics, and we test their patients to see if this could be something that could be contributing to their issues.
Wow. And FN stands for Fusobacteria
Yes.
nucleatum, correct?
Yes.
Okay.
Good job.
Saying,
Yes. Good
saying
job.
FN is a lot easier for sure.
Yeah. Yeah.
And then
For
you
sure.
mentioned treating it. So in that patient who had that, how did you treat it? How do you treat this bacteria?
So FN is actually a really stubborn bacteria to get rid of. And what we typically do is we render periodontal therapy, and which means that we have to clean beneath the gum line. So in our mouth, we have bacteria that love oxygen, that kind of live on all of our surfaces because it likes to breathe the oxygen. FN is one of those bacteria that like to live underneath the gum tissue in an anaerobic or an oxygen negative environment. And so we have to go under the gums to get that bacteria. Oftentimes I'll use things like ozone water to irrigate out or to try and kill any free floating bacteria. And then I like to use red light therapy to go in and try and reduce the amount of bacteria. Oftentimes what we see are these infections are so severe that we do have to use antibiotics to clear it. Because after we render this periodontal therapy, this bacteria will go into the bloodstream, unfortunately, and circulate in the body before the body can really rid itself of it. So oftentimes I will recommend antibiotics, but then we always make sure to go back and seed the gut and oral microbiome afterwards to put back what we want to be there.
Wow. Have you seen personally, like when you've treated men, that once you treat the bacteria, their semen parameters get better?
So all of it is anecdote from what they tell me. So for instance, I had this one patient in my prior practice. I actually was enrolling him in a toothbrush study because he was coming in to see us about every 8 weeks for cleanings. I know people are used to 6 months. That's way too long to in between your dental cleanings. He was coming every 8 weeks because his gums were always in bad shape, but he also had really bad oral hygiene, even though he swore to me that he brushed 5 times a day. So I was trying to enroll him in a toothbrush study with Colgate that I was doing. And I started talking to him about the importance of trying to get his microbiome healthy. And I said, this probably doesn't pertain to you, but I said, this will eventually cause erectile dysfunction or exacerbate erectile dysfunction, and it will affect your fertility. And he said, you know what? My wife and I, which I didn't know he was married, we are undergoing some fertility testing right now because we can't seem to get pregnant. And she's fine, but I have low sperm count and slow swimmers, is what he said. And I was like, well, let's get you in this study. Let's do some salivary testing. Let's see if we can get you healthy. The toothbrush study showed he was only brushing for about 25 seconds. It was 5 times a day, but it was about 25 seconds each time. He had a very high prevalence of PG, Porphyromonas gingivalis, which directly affects the sperm in men. And then he had a very low abundance of commensal or beneficial bacteria. So we got rid of PG, we improved his hygiene, and we reseeded his microbiome. And yeah, they ended up getting pregnant, which was great. Who knows if it was because of what we did or just luck, but either way, it definitely is reducing his systemic inflammation and making him healthier.
Okay. Well, now as part of my new patient intake, when I talk to folks, I
Yes.
have to set
Yes.
aside time to talk about oral health because it
Yes.
sounds
Thank
like
you.
we're
That's
we're
my
missing a
mission.
yeah, it sounds like we're missing a huge opportunity to help folks. So thank you for this information.
I'm so passionate about this because I was a fertility patient for 6 years. So I've gone through a lot of this stuff and I had a lot of heartache through all of it. And I know the importance of just taking a well rounded, comprehensive approach. And so that's really why I'm passionate about oral health and fertility. I'm trying to help as many women as I can have success stories. And so part of my mission is getting out there, working with fertility doctors and coaches to try and say, like, hey, at least put some questions in there about oral health. And if someone hasn't ever been checked, at least refer them out to get them checked.
Right. And do you think all dentists are mindful of these connections or
No,
so I should find folks in the community that I can refer my patients to who are mindful about that.
absolutely.
Okay. So if someone, let's say, has something along the lines of poor embryo quality and
Mhm.
also sperm issues, how would you use oral health as part of your treatment approach?
Yeah. So when someone's having, issues with embryo quality and or sperm quality and quantity, we want to try and get both partners as healthy as possible. And we really know that inflammation is the root of all evil and all preventable disease in this country. So we really have to look at patients and say, how can I reduce their systemic inflammatory burden? Because if there's inflammation going on in the woman in her reproductive system, it's going to be very hard for anything to implant there or to make high quality eggs. And so what I always say is if we've gotten you before you're ready to start your fertility journey, you're just thinking about it, get a saliva microbiome test and find out what's there. It's easily treated. There's never been a case that we haven't been able to remedy. And so if you do a saliva test, if you do some dental x-rays, we can see if there's any cavities or abscesses on teeth. We can eradicate it, get you and your partner healthy, and then at least we know that that is not causing any kind of systemic inflammation. So it's all about trying to set the patient up as best we can to make the best environment possible for an embryo to implant.
Yeah. Do you have a specific saliva microbiome test that you tell patients to get?
So there's many on the market, and a lot of people will say, "Hey doc, my dentist doesn't do saliva testing. How can I get my hands on one?" And so there's certain providers around the country, myself included, that can send kits to patients, and they can do a microbiome test, and then we can review the results with them remotely and work with their current dentist on trying to get them the appropriate treatment. And so a couple on the market that I really like are Oral DNA. They have a really great microbiome test. Simply Perio is another one that's really good. And then I really like the Bristle test because they also test for good commensal bacteria. So, yeah, and there's more coming too as this is growing. So,
Okay, very cool. And you also mentioned things like red light. Is there a tool that patients could get at home and do red light therapy at home for their mouths?
So that I get a little bit nervous about because I don't want someone thinking that, oh, I can buy a product on Amazon, right, and treat myself at home because we have to get rid of the source of infection first, which is the bacteria under the gums. That can only be removed by a professional. And then once all that is removed, using red light on your own is something that can biostimulate the tissues, biostimulate collagen to heal. That can be done on your own. But a lot of dentists will use lasers, which is red light therapy, to go in and kind of jumpstart that process. So I would say, get treated first. And then the important thing that I always try and do with my patients is, let me treat you, let me get you back to baseline. And then I'm going to arm you with tools or give you all the information that you can continue to maintain this on your own at home.
Yeah. And what about an oral probiotic? Is there one that you are a huge fan of?
Yeah, I mean, there's so many. What I'm telling patients is if you're going to take an oral probiotic, make sure it's either liquid or make sure it's a lozenge that melts in the mouth. There are some oral probiotics like on Amazon that you swallow, but again, if you're swallowing, you're bypassing where it needs to go. It needs to dissolve in the mouth. I think any of them out there are going to be good. I always say to look for something with the lactobacillus strains. Strep strains are really good as well for the mouth. But something that I really like is ensuring that we're giving our oral microbiomes enough prebiotics. Prebiotics and postbiotics have actually been shown to be much more effective for the oral microbiome than an actual probiotic. And so there's a company called Daily Dental Cares that makes something called Protectin and Fossident. And essentially, they're mint lozenges. They taste awesome. And one is really good for killing the bacteria that causes tooth decay. And then the other one is really good for killing periodontal pathogens. And so essentially, how it works is it turns the mouth into a ketogenic environment. And we know that those bacteria really love sugar or carbohydrates. And so if you turn it ketogenic, then those bacteria tend to die off, and then the commensal bacteria can thrive. So those are the two products I really love.
Very cool. Thank you for that. I'm
You're
sure people
welcome.
are writing notes right now, but will have links
Yeah.
to all these products in the show notes. So many of my patients take hormones, obviously, because I'm a fertility doctor, and some of the meds are things like estrogen or progesterone. How do those impact the gums or mouth, and do they?
Yeah, they do. So we know that those bacteria, are going to cause vasodilation, right? And it also increases the amount of inflammation that's going on. And what happens in our gums is that when we have inflammation, there's an enzyme that is released called MMP8. MMP8 is a collagenase enzyme. It's the same enzyme that's responsible for breaking down the gut and causing leaky gut. But we also see that enzyme show up in the mouth and it starts to break down the gum tissues. Now, our gum tissues are supposed to be like our skin. It's supposed to be a barrier. Now that gum tissues are already at a disadvantage because we have these like teeth popping up through our gums. So we have these kind of weak points, if you will, in our oral barrier. But then if we have inflammation, and a lot of it is caused by those medications, that enzyme will come in and start breaking down the gum tissue. And when the gum tissue breaks down, the bacteria that are already in the mouth get direct access to our bloodstream. That's why our gums bleed. That is the connection between the mouth and the rest of the body. That's where the bloodstream is. And so those bacteria get direct access to the blood vessels. And we know that the oral bacteria can very easily translocate into the bloodstream, and then it starts circulating the rest of the body.
And then how do the hormones impact that whole interaction?
Just by
Because
causing the inflammation. Estrogen, it can be inflammatory.
got it. So from your standpoint, estrogen and progesterone, from an oral standpoint, you've seen it can cause inflammation.
Oh, for
Got it.
sure.
Got
We
it.
see that all the time too. Like if patients have, like as soon as they get pregnant, one of their very first symptoms, and it was for me, is bleeding gums. So it has a direct effect on our gum tissues. And so a lot of women will say, I had healthy teeth and gums until I was pregnant. And then I had, one of the first signs of getting pregnant was bleeding gums. It's very
Yep.
common.
Yeah. And you mentioned early on when we first started talking that patients, when they're trying to conceive, they're like almost afraid of going to the dentist, you know?
Yeah. 60% of pregnant women avoid going to the dentist.
So, what should people know about doing things like routine dental screenings, x rays, local anesthesia, cleanings while preparing for pregnancy, going through IVF, and even being pregnant?
Yeah, I would say the best time to go is obviously before, because we can do a lot of testing, we can do x-rays, and then we can render any kind of treatment that could reduce your systemic inflammatory burden and give you the best chances of getting pregnant. Now, let's say that you find yourself pregnant and you didn't have time to get to the dentist. Absolutely still go and get a saliva test. We have tools now that can allow us, like some sort of cavity detector, that we can go in and kind of put this little pin on teeth that will let us know if there could be a cavity underlying. So oftentimes, especially in early pregnancy, we can avoid doing those dental x-rays until at least second trimester. Obviously, we put lead aprons on, we shield the patient so that way it's safe, but try and go before. If not, at least get in as soon as you can. So at least we can do the oral microbiome test. And then if we do need to do any kind of treatment, we can do it. You can really do it anytime, but best time and safest time is going to be during that second trimester.
Yeah. And you're clearly a fertility minded dentist. I don't know any dentist that I've ever talked to that knows as much as you do about how, fertility and what the causes are, PCOS, endometriosis. So I know people who are listening will want to know where they can find you and even work with you outside of Colorado.
Yeah, a couple really good places to find me. Instagram, I get messages all the time. I was just talking to a patient in Australia, got her connected with a holistic dentist in Australia. So Katie Lee DDS is my Instagram. You can find me on Facebook also for Katie Lee DDS. My website is katieleedds.com. You can book an appointment directly with me and we can test your saliva. And part of that program is once we get the results, I'll work with your dentist to render treatment. And then I'll also give you a full care plan that involves nutrition, supplements, products, everything you need to maintain your oral health. Or if you want to make a trip to Colorado, my brand new practice is the Collective Health Society. And we have a whole segment of our practice carved out for women's health. So I have a women's health coach. We have a nurse, I have a certified nutrition specialist, a functional medicine doctor, and then myself. And we all work together to try and give women the healthcare that they deserve.
Wow. You've really thought of it all. That's great. So, is there anything else you'd like to add today?
If you've been experiencing infertility issues for a while and you can't seem to figure out, what could potentially be causing it, and you tried everything, just do a saliva test. It's that easy. When we're undergoing fertility treatment, I was a patient for 6 years. There are so many shots and pills and scans and procedures you have to do. A saliva test is super easy. So don't be afraid of your dentist. I know no one likes to come visit us, but we're there to help you.
That's right. You don't have to take your pants off to do a
You don't
saliva
have to take
test.
your pants off.
Right, right.
Just get a saliva test.
Well, thank you so much, Dr. Katie Lee, for joining me today and opening our eyes to the hidden links between oral and reproductive health. If today's conversation sparked any aha moments for you, or if you're wondering whether your mouth could be part of your fertility story, be sure to check out her book, Saved by the Mouth, and connect with her online or through her telehealth practice. And as always, you can find me at dramy.org. And until next time, keep brushing, flossing, and believing in your fertility journey. Thank you, Katie, for joining us.
Thank you so much.